In the last week or so, there have been major updates in Foodie's lifestyle and health content. We all saw her struggle with exercising on the beach and then going to go visit some camels, but then she disappeared for a couple of days, and she came back with some news. Now, as a reaction channel, I have to put some thought into how I choose to present the information to you, and as you know, I like to think in terms of spreadsheets and data. So here's a brief visual summary of what's been going on with Foodie for this calendar year, or CY24. Each column from left to right is a different behavioral cycle that we're all pretty much familiar with, right? And then down the left, you've got different elements of each cycle. When you look at it like this, altogether, it's pretty clear that Foodie's health problems are starting to compound upon themselves in a relatively short period of time. She's gone from being on one oral medication to manage her type 2 diabetes to being prescribed multiple medications to better control it. For those of you unfamiliar with the disease, being placed on insulin is a huge step in type 2 diabetes management. So let's keep all of this in mind as we listen to Foodie's recent updates and try to fill in the holes of the big picture.
I'm super excited. I'm super happy. And I woke up from a nap, I took my blood sugar, and it's been the lowest it's been so far in a long while, like since being sick. So my blood sugars have been going up and down, but they've been not going down very much. When I got sick on July 1st, basically, they were high. Like, the highest was 25 mmol. I'll try to convert that for you guys, but maybe not, I don't know. So my journey has been going to a clinic, and a private clinic, basically getting assessed, getting blood work done, urine sampled, whatever I could provide, because you guys saw in my picture where I'm like trying to drink those little cups of water. Like, I don't know why, but I wasn't giving out anything that day, hardly. So probably because of the infection, but every time I think of that, I want to drink water.
Okay, so this is a good place to stop and explain a bit more. That day that Foodie was out in the desert, walking, seeing the camels, after going to the beach, remember that day? She wasn't feeling well, and they decided to go to a clinic. Now, this is a picture she took in the clinic waiting room. Does it look familiar? Well, I can confirm from the chairs and the tiles in the waiting room that it's the original doctor she saw back in December of 23, the one who diagnosed her officially with diabetes. And yes, this is in addition to her earlier diagnoses of type 2 diabetes in Canada, many years before. So let's call this doctor Dr. Number 1. Dr. Number 1 takes her blood work again, gives her a urinalysis, and determines that she has a kidney infection, so he refers her on to the ER. Dr. Number 1 can also tell that Foodie hasn't really been sticking to his plan for the last 7 months, so he arranges for her to come back and get more treatment from him just for the diabetes. Remember, Dr. Number 1 was an endocrinologist. Okay, so back to Foodie's update.
After the clinic, they saw my numbers, and specifically like the creatinine level and like the urinalysis that came back. The doctor was concerned, and he was like, you need to go to the emergency. I'm going to write you a letter to go there with the concern. So I spent some time in the hospital, in the observation department, women's observation, and the doctor made me a couple follow-up appointments. He made me a follow-up appointment with internal medicine, like to follow up regarding everything, the medications they put me on, my blood sugar levels and this and that. And then a little slip to go anytime to set up an appointment for some diabetic education, which I will do very soon. And so I had my appointment on Wednesday. Today's Thursday. I was discharged from the hospital Monday night.
Okay, so it seems like what happened in the hospital was that her UA results were so bad in the clinic that Foodie was treated immediately for the kidney infection. I can attest that from personal experience, That involves just getting a couple of liters of fluid and some IV antibiotics. The rest of the time in the hospital seems to be spent in observation. And if you noticed her meals, she showed chicken and rice, tea with some kind of biscuit. They didn't have her on a diabetic diet yet because they were trying to figure out how she was eating at home and how insulin would affect it. Her follow-up to all of this was to go back to the original clinic to her endocrinologist and talk more about her diabetes. That's Dr. Number 1, who told her to come back to the diabetes clinic and wrote her an order for the obesity clinic and nutritionist. Still with me?
He just basically was like, okay, how are you doing? How are your blood sugars? And my blood sugars at that time, like I tested my blood sugar before going to the appointment, and it was like 18.5. So it was really high. And I was just like getting discouraged because like, I was just like really like no matter what medications I took, whatever, nothing was working. And I remember the doctor in obs saying to start with 5 units of insulin, which apparently was like too low because you're supposed to also go by body weight. So the doctor was like, well, yeah, 5 units of insulin is too low. So you have to go by what your body weight is. So he checked the report with my body weight. So yeah, he went by that, and they weighed me at the clinic, so it was on the report that the doctor wrote for them, so they still had that in the system. And yeah, so he upped it to 15 units of insulin at around 10 p.m. in the evenings, and he put me on some new medications. One is, I'll show you them, I guess, for educational purposes.
At this point in the story, Foodie goes on to tell us that she's on a nightly injectable insulin called Lantus and 2 other oral medications, Zocor and Forxiga, in addition to her Janumet. She's also continuing oral antibiotics for the kidney infection. The interesting thing about that last segment is that it demonstrates that Foodie really doesn't understand how insulin works. The one she's taking, the Lantus, is a long-lasting insulin that you take once a day, not rapid-acting that you would take, at mealtime. So she really needs to sign up for that education class because she's already starting to confuse herself. And that part about being told to take 5 units of Lantus that first night, something's not right there.
Because the doctor's like, what can change all of this is if you just completely get your way under control. So I'll get to that in a minute. The healthcare I've been getting so far in Kuwait, I just like it so much more than what I've been getting in like Canada. Like, I don't know how it's just like more accessible. I don't know if it's that, I have Salah with me like as a support and it helps. I don't know what the deal is with that, but I find that like I definitely just feel more hopeful and not like, oh my gosh, like I see a lot of people worried, like, you need to come back to Canada. And it's like, why,
The short answer here is, Foodie, you didn't even try in Canada. You had walk-in clinic options where you could have gone to get help for your diabetes, and you just didn't. Now, before I go, I want to share with you one last point. I think we're missing a lot of information here. It'll be interesting to see how this all unfolds in the coming weeks. For the record, I do not think that Foodie's being 100% honest with us. I'm sure that Dr. Number 1 saw a lot more in her lab work than she's telling us, and she's either omitting or not remembering things properly. For example, at one point she tries to tell us that everything involved cost about 10 KD, and I simply don't see how that's possible, considering her clinic visit back in December of 23 cost 47 KD. See why we need the spreadsheets? Drop me a line in the comments and let me know what you think about all of this. I'd love to hear from you.